In July, we aggressively began advocating with the federal government, both to Secretary Becerra and to other federal leaders, that we needed an increased availability of vaccines. This situation that we face today is fundamentally different than the one that we faced in COVID, and that there already is a vaccine, there is treatment, and we know much more about it. It is also order of magnitude less transmissible than that.
This action will allow availability of personnel, such as pharmacists and EMTs, to also administer vaccines, to utilize state resources for vaccine administration, and to leverage the public health infrastructure related to testing, contact tracing, and as well as case investigation, and community outreach and engagement. All of these strategies were developed and strengthened during the COVID-19 response. San Diego County is declaring a public health emergency to manage response efforts to the local monkeypox outbreak, including testing, contact tracing, vaccination, and outreach and education.
To date, we have received 3,987 vaccines and have administered 2,065 for pre-exposure prophylaxis, the prevention of monkeypox, with 559 being held for post-exposure prophylaxis for those individuals that have been exposed to monkeypox.
For us, health and safety of all San Diegans is our absolute priority. And while the county has taken early action, we're asking for support and collaboration to help us prevent the spread. And like Dr. Wooten and my colleague Chair Fletcher has mentioned, education and prevention is our top priority.
I thank and I'm proud to be a member of the LGBTQ community that has taken this issue extremely seriously since the first cases were noted. This community understands and it has experienced outbreaks of viruses in the past. We have seen this before and we've learned those lessons and we've taken it very seriously. I want the community to know that the government is taking this seriously as well. The public health community is taking this seriously as well. As mayor of this great city, I want to ask every San Diegan to take this issue seriously. Take a moment to educate yourself about monkeypox, understand the risk factors that are involved, and make sure that you take the proper precautions for yourselves and for your loved ones to make sure that we stop the spread of monkeypox in our community.
You have enough cases of a disease like this. I'm sure that eventually there could be a death in the United States, perhaps in California, but that's what we're trying to avoid by being very aggressive now to get this outbreak under control.
Even with one dose is 80% effective. With 2 doses, there's 85% effectiveness after 2 weeks after receiving the second dose. So there is some immunity after receiving a first dose, which is why the first dose strategy is being used given limited vaccine supply. When we do have vaccine, to go through the second doses, the county would like to go through and try to vaccinate individuals that are due for their second doses as well. But the current strategy is get as many vaccine in arms as possible.